Well, this is another area where we've gotten into, and that's the psychiatric problems. And I noticed that I've read several articles where the Veterans Administration, or excuse me, Veterans Affairs Department has in fact increased and is increasing their budget and for personnel to assist returning veterans with those kinds of problems. And I think as you get people with multiple tours, you're going to have more and more of these kinds of problems.
Along those lines, Phil, maybe you could address some of the services that are offered in relation to that, and also there's a hotline number for veterans who are contemplating suicide, as we talked about before the show. Right now, unfortunately, the number or the percentage of veterans who are committing suicide is at an all-time high in the history of the U.S. military. And there's a federal hotline that's available. We have the number here which you can give, and also talk about services that the state offers in terms of local programs.
And I appreciate the question. As you mentioned, people that serve in combat or in the military and we put into harm's way are forever changed, and of that there can be no doubt. And the term that we use these days is of course post-traumatic stress disorder, or some of our guys even with head trauma that they experience nowadays, traumatic brain injury. The VA does have, of course, a mental health that a veteran can go to and seek treatment. And then here in local areas even, the VETS Center. The VETS Center is a program, of course, that came out of the Vietnam conflict. It's a little bit away. The idea is that it's a little away from the VA establishment, the old brick and mortar building. So when they go in and seek assistance from a mental health provider, it's a little more the dimmer recess lighting, a little calmer, so they don't feel like they're in the establishment. And it's a little more one-on-one than they could get at the VA sometimes. They do run groups there. The state of Maryland also has a Maryland commitment to veterans. So if a vet could not get into a VA system, then they could be referred to a local provider through Maryland's commitment to veterans to be seen for mental health issues as well. You mentioned the VA 1-800 suicide prevention number, and that number is 1-800-273-8255. And a veteran can call that number and they'll do an over-the-phone assessment of that individual and then make a referral to a local facility, or, depending on the scenario, they'll take the next appropriate step.
Is that numbers the new crisis number also? In other words, it's my understanding that somebody other than a veteran who has a problem or sees a veteran with a problem can in fact call the crisis number and help the veteran who may not be helping himself. Okay, so a family member.
Absolutely,
yeah.
Absolutely, and when we come in, we interview our vets. We tell them to be to be conscious, and we talk to the families, because you're right. A veteran is typically the last to notice subtle changes within themselves. It's usually those family members around them that notice it first. So absolutely, a family member could call that number for a veteran.
And also a friend or even a teacher. A lot of times veterans go back to school when they come home, and sometimes teachers, professors pick up things. They can see it happening. Anybody can call that number, anybody who's concerned, and it is all confidential, correct?
Correct.
Okay, so you don't have to worry about your identity being revealed or creating a conflict with someone. You're trying to help that person, and you can at least get some idea of what you can do to help.
Absolutely, absolutely.
Well, we've covered a lot of ground now, so maybe we ought to take a little break here.
Okay.
We'll take a little break here and then come back in a few minutes and discuss more of the problems that veterans have and help that's available to them. I think that's important, that there is a lot of help out there. It's a matter of finding your way through the system, and I think Phil and his office is very helpful in helping people get through the system, and that's what we're trying to do. So we'll take a break now.
Great, thank you.
Great.